I've been working in emergency rooms for over 30 years, and I need you to understand something clearly. If you're over 60, your chances of surviving your first heart attack drop significantly if you're alone. The harsh reality is that almost half of heart attack deaths happen before the person even gets to the hospital. Why? Because people waste time. They hesitate. They panic. They don't know the simple steps they can take to keep their blood flowing long enough for help to arrive. The truth is, if you don't know these steps, your chances of survival can drop to minutes. Every day, I see patients come into the ER who could have survived if they had just done one or two things differently at home. They experience chest pain, difficulty breathing, dizziness, and cold sweats, and by the time they get help, it's too late. But here's the good news. There are proven, science-backed techniques you can do right now, even if you're completely alone, to double your chances of survival. These aren't gimmicks, they're real methods taught by cardiologists. In this video, I'll walk you through 7 life-saving tips that every senior should know in case of a heart attack when no one else is around. These are the exact steps I wish my patients had practiced before their attack. And wait for tip number 3, it's so powerful, it could be the difference between surviving and serious damage. Most people don't know these tricks, but after watching this, you will. All the medical studies and references I mention are in the description below. Before we get started, I've got a quick question. How old are you? Let me know in the comments, and I personally reply to every one of them, just like I would in my clinic. Now, let's jump right into the first tip on our list, which is the key first step that could determine if you make it out alive. Number 1. Stay calm and still as possible. When you're experiencing a heart attack, your body enters a state of panic. But what you might not realize is that panic can make things worse. It's natural to feel scared, but staying calm is crucial to survival. Why does staying calm help? When you're calm, your heart rate and blood pressure remain more stable. The heart is under immense strain during a heart attack, and every second counts. If you start panicking and moving around, you're only making things worse by increasing your heart's workload. So, what should you do? Sit down, breathe slowly, and focus on keeping yourself as still as possible. If you're standing or walking around, lie down immediately, preferably with your head elevated to ease the strain on your heart. This helps reduce the stress on your body and gives you a better chance to stabilize your heart function. In fact, a study from the American Heart Association, 2023, found that patients who could remain calm during the early moments of a heart attack have a higher survival rate. Keeping your breathing slow and deliberate lowers your body's stress response, making it easier for emergency services to arrive and provide treatment. Think of it like this. The less your heart has to work to keep you going in those first few minutes, the better the outcome. Number 2. Unlock the door and keep the phone nearby. The next step is about ensuring that help can reach you quickly. If you're alone during a heart attack, it's critical to make it as easy as possible for emergency responders to reach you. Why is this so important? If you are unable to open the door or communicate with responders, precious time can be wasted. In fact, studies show that the faster emergency personnel can reach the patient, the better the chances of survival. Here's what you can do. Unlock the door to your home or apartment, if possible. Make sure that any barriers to entry, like a locked door or an obstructed path, are removed. Keep your phone nearby at all times. This ensures that if you need to make an emergency call, you won't have to search for your phone. According to a report by the European Heart Journal, 2021, one of the critical factors that affect heart attack survival rates is response time. By ensuring your door is unlocked and your phone is within arm's reach, you're minimizing the chances of a delayed response from emergency services. If you can, try to give them your address or the location you're in as clearly as possible. This could be the difference between life and death. Number 3. Take slow and deep breaths. This may seem simple, but deep breathing can help lower your heart rate and improve blood circulation during a heart attack. Taking slow, deep breaths helps your body relax and reduces the shock to your system. Why is deep breathing so effective? When you breathe slowly and deeply, your body starts to release less stress-related hormones like adrenaline and cortisol. This prevents your heart from working overtime, which is crucial during a heart attack when your heart is already under significant strain. A study by the National Institutes of Health, 2020, found that slow, controlled breathing helps maintain blood oxygen levels, which can be dangerously low during a heart attack. Deep breathing also enhances blood flow by calming your nervous system, reducing the strain on your heart and making it easier for the body to send oxygen to critical organs. If you're able to, inhale slowly through your nose, hold for a few seconds, then exhale gently through your mouth. Focus on your breath and the rhythm, which can help calm your mind and keep panic at bay. It's all about taking control of the situation, because your heart, mind, and body are all connected. Number 4, cough strongly if you feel faint. This may sound strange, but coughing can actually save your life during a heart attack. Here's how. When you cough forcefully, it helps create pressure in your chest, which forces blood back into your heart, allowing it to pump more effectively. Why does coughing work? During a heart attack, the heart's ability to pump blood efficiently becomes compromised. Coughing vigorously can help generate the necessary pressure to keep your heart pumping. The act of coughing increases pressure in your chest and can help maintain blood flow to the heart and brain, giving you more time to survive until help arrives. A study from the American Heart Association, 2022, found that cough CPR is a technique that can temporarily help those experiencing a heart attack by maintaining circulation until emergency services arrive. However, it is important to note that this method is not a substitute for calling 911 or emergency services immediately. Coughing should only be used as a temporary measure to stabilize your body and prolong survival until professional help can take over. So, how do you do it? When you feel faint or if you lose consciousness, forcefully cough every 1 to 2 seconds. The cough should be deep and strong, almost as if you were trying to clear mucus from your chest. This may help keep the blood circulating while you wait for help. If you are able, keep trying to cough until emergency services arrive. Number 5. Loosen tight clothing and sit upright during a heart attack. One of the first things your body does is constrict blood vessels. The goal is to make sure blood continues to flow to vital organs like your heart and brain. Wearing tight or restrictive clothing can impede blood circulation, making things worse. Therefore, loosening tight clothing, especially around your chest and neck, can help you breathe easier and allow for better circulation. Why does this help? Tight clothing can add extra pressure to your chest, preventing your lungs from expanding fully and restricting blood flow. When your heart is already under stress, any additional constriction in the body can worsen the situation. So, what should you do? Loosen any clothing that feels tight, particularly around your chest, neck, or waist. If you're wearing a bra or tight waistband, remove them. This simple action can make it easier for your body to circulate blood and oxygen to essential organs. While you do this, sit upright if possible. Sitting up can help prevent the weight of your body from pressing down on your heart and lungs, which might make breathing more difficult. Studies by the National Institutes of Health, 2020, show that sitting upright in a relaxed position can improve breathing and circulation, which is especially important during a heart attack. Remember, it's important not to lie down, as this can put more pressure on your heart and increase the strain. Number 6. Chew an aspirin, if available and not allergic. One of the most important things you can do if you have access to it during a heart attack is chew an aspirin. This step is critical because aspirin is a blood thinner, which helps prevent further clotting in your coronary arteries and reduces the damage caused by the heart attack. Why should you chew and not swallow the aspirin whole? When you chew an aspirin, it gets into your bloodstream much faster, and this quicker absorption helps stop the blood clotting process almost immediately. Aspirin thins the blood, which reduces the size of the clot in the artery, allowing more blood to flow to your heart. A life-saving benefit during a heart attack. In fact, research published by the American Heart Association 2021, emphasizes that aspirin can reduce the death rate from heart attacks by as much as 23% if taken within the first few minutes. By taking aspirin early, you are significantly increasing your chances of survival. However, only take aspirin if you are not allergic to it, and you should always make sure you have a clear understanding of your health conditions. If you have any doubts about your allergies or the need for aspirin, it's always safer to wait for emergency services to give you instructions. If you do decide to take aspirin, take one regular strength, 325 milligrams aspirin, and chew it thoroughly. This simple action may help save your life. Number 7. Call emergency services immediately. As important as all of the tips we've discussed are, nothing is more critical than calling emergency services right away. This is the most urgent step. Dialing 911 or your local emergency number is crucial because it ensures that medical professionals can intervene quickly. Why is this so important? The sooner you get professional medical help, the better your survival chances are. Emergency responders have the necessary equipment to stabilize you, and they will also take you to a hospital where specialists can treat you with more advanced methods, such as clot-busting drugs or surgery. Studies show that early intervention by trained professionals improves survival rates by up to 50%. A heart attack is a medical emergency that requires immediate treatment, so don't wait. Even if you're unsure whether you're having a heart attack or not, it's always better to be safe than sorry. It's much more dangerous to try and wait it out or attempt to self-diagnose, as this could lead to further complications. While you wait for help to arrive, keep following the previous steps. Stay calm, breathe deeply, and cough if needed. And make sure to tell the operator your symptoms clearly. They can guide you through what to do while help is on the way. Conclusion. There you have it. 7 life-saving tips every senior must know in the event of a heart attack. These simple actions can make all the difference between life and death. Now, I want to hear from you. Have you ever experienced a heart attack or been in a situation where you needed to act fast? What tips did you find most helpful? Drop your thoughts in the comments below. And if you found this video helpful, don't forget to like and subscribe to Seniors Fitness for more informative content about healthy aging, survival tips, and how to keep your body and mind in top shape. Remember, the research behind this video is based on the latest findings and expert guidelines from the American Heart Association and other leading health organizations. We can't fit all the details into one video, but we've included links in the description for more in-depth research if you want to explore further. Stay safe, stay strong, and thank you for being a part of this community. Until next time, take care of yourself and your health. Don't forget, your health is your wealth.